Assalamualaikum everyone. I hope all of you are doing well. In this video, I am going to talk about a clavicular fracture. But before discussing the clavicular fracture, I am going to discuss a little bit anatomy of the clavicle. So you can see over here, this is the clavicular bone, and you can see it is the S shape. So it has got the two ends. One is the medial end, the other is lateral end. The medial end is articulated with the manubrium of the sternum through the sternoclavicular joint, while the lateral end is articulated with the acromial process through a joint which is called the acromioclavicular joint. Now the medial end is also called the sternal end, and the lateral end is also called the acromial end. So the clavicle has got the shaft. This is the shaft of the clavicle, and the shaft is divided into two regions. One is the medial 2/3 and the other is lateral 1/3. So the medial 2/3 is also called the sternal region, while the lateral 1/3 is also called the acromial region. So now going to the fracture of the clavicle. It can be dislocated from the sternoclavicular joint, and it can be dislocated from the acromioclavicular joint, and the shaft can be fractured. But most of the time the middle of the clavicle get fractured. So you can see over here, this is the fracture of the clavicle. This is the clavicular fracture of the middle section. Now going to the cause of the clavicular fracture. The first cause is the fall on shoulder. This is the first cause. The second cause is the direct trauma to the shoulder, and the third cause is fall on outstretched hand. These are the causes of the clavicular fracture. Now what are the signs and symptoms of clavicular fracture? There will be pain here at the clavicular region. In the shoulder region, there will be immobility of the affected arm, and there will be tenderness here, and there will be swelling here, and if the fracture is open, there will be laceration of the skin as well due to bone penetration through the skin. Now what are the complications of the clavicular fracture? The blood vessels and nerves are passed through this region. When this clavicle becomes fractured, there can be a chance of injury of blood vessel and chance of injury of nerves, and the skin is breached by the clavicle. Then air can be goes into the chest cavity and can cause the pneumothorax. These are the complications of the clavicular fracture. Now how to diagnose the clavicular fracture? The clavicular fracture can be diagnosed by taking history, by doing an examination, and by doing an investigation. So by taking history, the patient will tell you about the pain here, and by an examination there may be swelling and there may be tenderness here, and the skin may be bruises here due to clavicle penetration through the skin. By investigation, do the X-ray of the shoulder. It will clearly show you the fracture of the clavicle. Now how to treat the clavicular fracture? The clavicular fracture can be treated by two methods. One is the conservative method, and the other is surgical method. You should immobilize the clavicle by wearing the pulley sling, which can be found in two forms. One is large size, the other is small size. The large size is used for adults, while the small size is used for children. The another method for treating the clavicular fracture is the surgical repair. Now there are some indications for surgical repair. If there is nerves and blood vessel injury, this is the first indication. Then we should go for surgical repair of the clavicle. And if the clavicle breach the skin, this is the another indication for surgical repair. And if there is comminuted fracture of the clavicle, this is the third indication for the open clavicular fracture repair. And if the clavicle is not healed by 3 to 6 months, then we will go for surgical repair of the clavicle. So this was all about clavicular fracture. For more video, subscribe, like and share. So thanks for watching the video.